There can be a lot of different aspects that go into neck and back pain. I mean, you can be dealing with joints that don't move well, or sometimes too much, sometimes muscles or ligaments that can get strained or sprained that can get into problems, or even some of the nerves that control all these structures that can cause some of the problems and pain that a lot of people end up having to fight with every day.
Perfect. You experience neck and back pain, what should be your first move?
Well, it kind of depends on your symptoms. You know, if you're having any weird symptoms like some numbness and tingling in the arms or the legs, or maybe you've lost your speech, you know, just something out of the ordinary, it's best to seek, you know, someone, a professional physical therapist or your doctor. But if it's just kind of normal back, neck pain, not too painful, maybe just try some nice easy stretches, which I think we'll probably show you here a little bit later. But you could also try some heat and ice.
Most people would think you have to go to a doctor first to get a referral to come to a physical therapist, but that's not always the case.
No, actually in most states nowadays, there's been a lot of efforts to make it easier to break down some of the barriers to get in to see physical therapy. And so most of the Midwest states, Iowa, Illinois, Wisconsin, are all what we call direct access. So you can come right to physical therapy without needing a referral from a doctor, depending on your insurance. If you have most insurances that from an employer, that sort of thing, you can come right to us. It's just that the Medicare, the Medicaids, or the military insurance do still require a visit to a doctor, or at least a script from a doctor first.
Some of us are the weekend warriors, run the 5K and then are really sore after. What are some stretches that you can do to alleviate that pain? And maybe this would be a good time for us to show some.
For the neck, there's a couple exercises that we generally recommend. One would be for the upper trap, another for the levator scapulae. So the upper trap generally goes from about the base of your neck to the top of your shoulder. Okay, so how we stretch that is we take our left ear, so if we're stretching the right side, take the left ear towards your left shoulder. You should feel a nice kind of easy stretch through the outside here. Shouldn't be too painful. If in fact though you're doing this and your shoulder tends to come up with you, that's when we have somebody sit in a chair and maybe hold the chair to kind of lock that shoulder down. Okay, so just taking what we just call ear to shoulder. Another one's going to be chin to shoulder. So you're just dropping your chin down towards your chest. Okay, this is for the levator scapulae, then taking your chin over to shoulder. Again, if this tends to come with you a little bit, kind of grab hold of a chair, but you should feel this one, even maybe sometimes this side, just depending on what's tight. So that would be for the neck. For the low back, I'll kind of demonstrate on the table if that's okay. So there's a double knee to chest stretch and then a single knee to chest stretch. Those are ones that we commonly use in the clinic. Okay, so the double knee to chest, just exactly what we've said here. Okay, so you're just laying down, you're taking one knee, grabbing the other knee, kind of giving yourself a good hug. For all stretches, usually I have people hold them about 20 to 30 seconds. Okay, another good one is the single knee to chest. So you're just pulling the knee up to your chest, holding there. Generally people feel it down through the glute, that butt cheek area, kind of into the low back. So those are a couple good ones there that you can use.
And these are all seem pretty simple. You can do these at home or at your local gym. You don't necessarily need to go to a doctor for these.
Exactly. And if in fact though your pain is starting to kind of hang around a little bit, maybe that's the time to see a physical therapist. But yeah, that's a great start.
As we head into winter, we see those common injuries, neck and back pain. Any tips to avoid those as we go into the colder months?
Yeah, as far as neck pain, a lot of times we'll get ourselves into trouble just from more sitting. And seeing as none of us really like going outside a whole bunch when it's -10, we tend to sit around a little bit more. And so some of the things that I like to encourage people to do is even just get a break from the forward head position that all of our electronic devices that some people may be watching on right now kind of draw us into. But even just a quick posture check every so often of getting yourself up nice and tall. Just imagine you had a string on top of your head that pulled you up nice and tall, and give yourself a break from being stuck in that position for a long time. As far as the low back, we can get a lot of issues with either falls on the ice or people out scooping snow that are in over their heads. Yeah. And so things that we usually like to recommend with that are, one, being careful as far as walking on the ice, especially if you're watching this online right now. Looking up a video on walking like a penguin can make it so that you're less likely to fall. That kind of bring your weight forward and not necessarily striding out and getting yourself in a position of falling. But also for that scooping snow, obviously we've all been told it before, of that lift with your legs but not with your back. In fact, that it just becomes a matter of doing it right. We can't just get too far along the way and get tired with it and get to the point where where we start, oh, well, I just have that last 5 feet that I'll get lazy, because that's when we get ourselves into trouble as well.
If one of our guests goes to a physical therapist for the first time, what can we expect for them to see?
Coming to the physical therapist for the first time, you're going to want to expect some movement, so wear some comfortable clothes. Typically, your physical therapist is going to sit down with you at first, kind of discuss what's going on, your symptoms, how that's impacting your daily life. We generally then take you through some tests and measures, just trying to figure out a little bit more about what's going on, and then we like to treat. And a treatment can be a wide variety of things, but almost always we include exercises. So we will give you like a home exercise program, nothing to be afraid of. We try not to overwhelm people, but it's just to get you moving, get you feeling better.
And how long can people expect this to be? About an hour for that first meeting?
It just depends on where you go. Here at Unity Point, we spend about 45 minutes with you. And that's another thing to keep in mind too, is we do one-on-one patient care here. So if you're going somewhere else and you're one of 3 or one of 4, maybe think about a different place where you're actually getting quality care and you are the only person.